वेलकम टू स्पेशल एजुकेशन विद हामिद नकवी। आजकल हमने MCQs का एक नया सिलसिला शुरू कर रखा है स्पेशल एजुकेशन के हवाले से, और आज उस सिलसिले के हम विजुअल इम्पेयर्ड चिल्ड्रन के जो MCQs हैं उनकी प्रैक्टिस करेंगे। सबसे पहले मैं ये वाज़ेह कर दूं कि जो ताज़ा तरीन अखबार में इश्तहार आया है, जो वैकेंसीज अनाउंस हुई हैं, उसके मुताबिक जो विजुअल इम्पेयर्ड की कैटेगरी है उसका एक रिटन टेस्ट होगा जो बेसिकली मल्टीपल चॉइस क्वेश्चंस की तरह का होगा, ऑब्जेक्टिव टाइप होगा, ये 100 नंबर का होगा, 1.5 घंटे का पर्चा होगा। और इसमें जो सवालात हैं वो 80% जो हैं वो आपके सब्जेक्ट रिलेटेड होंगे। इसका मतलब ये नहीं है कि सिर्फ फिजिकली हैंडीकैप्ड के, बल्कि स्पेशल एजुकेशन के हवाले से जो जनरल क्वेश्चंस हैं वो भी होंगे। तो आप जब तैयारी करें तो खाली फिजिकली हैंडीकैप्ड की बुक्स को ना देखें, बल्कि स्पेशल एजुकेशन की जो बेसिक कोर आपकी बुक्स थी पहले सेमेस्टर की, उनको आप ज़रूर उनकी तैयारी करें। तो बाकी 20% जो जनरल एबिलिटी के टेस्ट है उसमें सारे सब्जेक्ट्स के दो 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 चार चार सवाल होंगे, जैसे जनरल नॉलेज, पाकिस्तान स्टडीज़, करंट अफेयर, ज्योग्राफी, इंग्लिश, बेसिक मैथमेटिक्स, उर्दू, एवरीडे साइंस और बेसिक कंप्यूटर स्टडीज़ है। और साथ में ये भी बता दूं, ये हमने नई सीरीज जो अब शुरू की है इन इम्तिहानात के ऐलानात के बाद। उससे पहले 39 वीडियोस जो है MCQs और वाइवा के हवाले से वो हमने पहले अपलोड कर रखी हैं। और ये 39 वीडियोस ये MCQ की तरह की हैं, और इनको आप इनके लिए हमने एक स्पेशल अलहदा प्लेलिस्ट बना रखी है। और उसको आप अगर प्लेलिस्ट को क्लिक कर देंगे तो तमाम 39 वीडियोस आपके सामने आ जाएंगे, और आप सबको या अपनी मर्जी की जो चाहें उनको आप सुन सकते हैं। और ख़ास तौर पे जो 10 वीडियोस हैं जो स्पेशल एजुकेशन की कॉमन है, उनको देखना ना भूलिएगा, क्योंकि उसमें से भी आपके सवाल होंगे। आज बहरहाल ये जो वीडियो है इसको हम सिर्फ हमने ब्लाइंड या विजुअल इम्पेयर्ड की जो फील्ड है उसके हवाले से ये MCQs तैयार की हैं। तो शुरू करते हैं। पहला सवाल है, द पार्शली ब्लाइंड आर दोज who have a visual acuity of 20 by 20, 20 by 60, 20 by 70, 20 by 90। सही जवाब इसका ये है 20 by 70। फिर विजुअल इम्पेयरमेंट इज ऑल्सो नोन एज ए विजन डिफेक्ट, विजुअल डिफेक्ट, विजुअल डिसऑर्डर, ऑल ऑफ द अबव। और सही जवाब देखते हैं, सही जवाब है all of the above. So visual impairment is also known as visual defect, vision defect, visual disorder। ये तीनों जो है नाम विजुअल इम्पेयरमेंट की जगह पे इस्तेमाल होते हैं। Unable to see distant objects clearly, commonly called near-sighted or short-sighted, is known as a night blindness, myopia, tunnel vision, कलर ब्लाइंडनेस। और इसका सही जवाब ये है मायोपिया। अगला सवाल, द मोस्ट कॉमन कॉजेज ऑफ ब्लाइंडनेस वर्ल्ड वाइड वर कैटरेक्ट्स, ग्लूकोमा, एज रिलेटेड मैकुलर डिजनरेशन, और ऑल ऑफ द अबव। इसका सही जवाब ये है ऑल ऑफ द अबव। अगला सवाल है, unable to see close objects clearly, commonly called far-sighted or long-sighted, is known as hyperopia, retinitis pigmentosa, Amblyopic or a cataract? Or correct answer is hyperopia. Next question is one of the most prominent identification of visual disorder is case study, case history, observation, psychological test, or interview of the patient. The correct answer is observation. Next question is an eye chart that can be used to measure visual acuity is Snellen chart, Scheller chart, Skellen chart एंड स्नेटर चार्ट और इसका सही जवाब है स्नेलन चार्ट. Which of the following is a top cause of preventable childhood blindness? Iodine deficiency, iron deficiency, vitamin A deficiency or protein deficiency. और सही जवाब है vitamin A deficiency. Blindness in children may be due to intellectual impairments and genetic mutation, birth defects and nutrition deficiencies, poor living condition and low socioeconomic uh, uh, and high exposure to bright light. सही जवाब देखते हैं. Correct answer is B, that is birth defects and nutritional deficiencies. Special educational arrangements for partially sighted children include the use of grey or green board instead of black, orderly pencils and papers, glare and direct sunlight seating, bright coloring of walls. सही जवाब इसका है A, grey and green board instead of black. Next question is who was the most important figure in the history of education of the blind? Louis Braille, Thomas Hopkins, Ellen Jebb, Herbert Hoover. Correct answer is Louis Braille. Next question is Anne Sullivan, who served as Helen Keller's tutor, suffered from orthopedically handicapped, speech defective, mental retardation, or visual impairment. Correct answer is visual impairment. Next question is which of the following device is suitable for teaching arithmetic to persons with visual impairment? Taylor frame, signature guide, foot pedal, or none of the above. Correct answer is A, that is Taylor frame. Next is digital and handheld magnifiers are useful for person with low vision, person with locomotor disabilities, person with speech and hearing impairment, none of the above. Correct answer is person with low vision. Next question is which of the following is not an assistive device to support persons with locomotor disability? Wheelchair, elbow crutches, K walker, or refreshable brain display. Correct answer is D. Next question is physical barriers include no ramps along with stairs for persons with locomotor disability, lack of elevators in most public places, lack of tactile path, and all of the above. Let's see the correct answer. Correct answer is D, all of the above. Next question is what is congenital blindness? A loss of vision after birth by age 5. A loss of vision before or at birth. Loss of vision as a result of an accident. And none of the above. Correct answer is B. A loss of vision before or at birth. Next question is what is Braille? An electronic display that helps visually impaired students read computer screens, a tactile output that helps students use telephones, a communication system of touch that allows persons who are blind to read, review, and study the written word, and none of the above. C is correct 1G. Then environmental accommodation for students with the sensory needs may include a seating placement of student, modification to the classroom, modification for instruction and instructional material, and all of the above. The answer is D, all of the above. What are the basic disability etiquette? Be sensitive about physical contact. Don't make assumptions. Ask before you help. All of the above. The answer is all of the above. Text to speech is used by persons of which type of disability? Persons with visual impairment, persons with speech impairment, persons with locomotor disability, none of the above. Answer is a person with visual impairment. Next is the primary cause of blindness for people over the age of 55 years is cataract, glaucoma, macular degeneration, diabetic retinopathy. Answer is C. What does it mean to be blind? All you see is darkness, the absence of functional vision or a severe reduction of vision. You see in black and white, no color vision, none of the above. Correct one is B. Next is what is symptom of low vision or blindness? Blurry vision, seeing spots, trouble seeing at night, all of the above. The answer is all of the above. All people who are blind need large print or braille. Is it true or false? It is false. People who are blind need guide dogs to be mobile in their environment. True or false? False. What areas of person's life does their low vision or blindness affect? Daily living, education, social skills, all of the above. Answer is all of the above. Dash help persons with low vision or blindness to see better. Other individuals, canes, optical devices, guide dogs. Correct answer is optical devices. That is C. Next is individuals with low vision or blindness strongly benefit from early intervention services. Is it true or false? It is true. Then which type of assessment would be the best when working with visual impaired child? Criterion referenced, non-standardized, standardized, and norm referenced. Correct is criterion referenced. Which of the following is not effective pedagogical strategy for inclusion of students who have severe visual impairment? Use of computer to give visual representation, felt books and felt boards, three-dimensional maps and charts, speaking clearly and explicitly. Answer is use of computers to give visual representation. What percent of people living with sight loss are completely blind? 1%, 2 to 3%, 4 to 6%, or more than 6%. Correct is 4 to 6%. If a student uses tactile or auditory resources as his or her primary channel of learning, he or she is completely blind, he or she is partially blind, he or she is functionally blind, and he or she are low vision. Correct is he or she is functionally blind. Then if someone has white cane, are they completely blind or partially blind? Completely blind, partially blind, both can happen, and none of the above. Both can happen. Which of the following statements best define low vision? Low vision is defined as visual acuity of less than 6 by 18 but equal to or better than 3 by 60. Low vision is defined as visual acuity of less than 6 by 18 in both eyes. Low vision is defined as visual acuity of less than 3 by 60 but equal to or better than 6 by 18. Low vision is defined as visual acuity of less than 3 by 60, and the correct answer is A. Which categories of patients that we see in practice might be affected by low vision? Patients over 70 years, children with pre-existing health condition, patients with low incomes, or all patient categories have the potentials to be affected by low vision. Correct one is D. The main cause of sight loss in UK are diabetic eyes disease, cataract, uncorrected refractive error, or ARMD and glaucoma. Correct answer is C. The low vision practitioners, when assessing visual acuity, use which type of test chart? Snellen, Logmar, Paley-Robson, or Tempting E? Correct is B. Logmar chart. Then who in practice can dispense low vision aids and give advice to patients with certificate or visual impairment? Any suitably trained member, only the optometrist, any GOC registered optician, or only a low vision optician? Correct is C. In practice, we are called upon to dispense handheld magnifier to patients with low vision. If a patient can see N24 with both eyes but would like to see in a text of N8, such as their bank statement, what magnifying would be required? 2x, 6x, 4x, 3x. D is correct. Then most magnifiers are figure of how many times magnification they are marked on them. A is the magnifier has been wrongly labeled. The magnifier is being used incorrectly. It depends on how magnification is worked out, and the magnifier is scratched and worn out. Correct answer is C. Then higher powered magnifiers tend to have smaller diameters, and many patients request a larger diameter strong magnifier to help with their near vision tasks. Which of the following is correct? Higher powered lenses tend to be smaller due to the constraints of manufacturing and weight. A large diameter lens makes them brighter. A larger diameter lens is easier to hold, and bigger is always better than patients with low vision. A is the correct answer. What is 3B's concept? The 3B's concept stands for big, bigger, biggest, bold, bolder, boldest, bigger, bolder, brighter, and bright, brighter, brightest. Correct one is C. That is bigger, bolder, brighter. Stay blessed. See you in the next